the reason why you're dealing with this is because of a history of just like incredibly horrific trauma from your childhood. Is that correct?
Yeah, because even in that same appointment when he kind of, smiled at the fact that like a relief of like, okay, he figured out it was FND. The next question he asked me was, have you been through a lot of trauma? Do you have depression? Do you have anxiety? And I was like, how does this even connect?
You know what I'm going to do is, fuck it, whatever. We'll just leave it.
Just raw dog.
Yeah, fuck it. We'll just raw dog.
I'm just going to start using that super out of context.
Use it like where it makes no sense at all.
Totally.
I want to start only using it with
I got to go to bed at 9:30 and I'm going to raw dog it. Go to bed at 9:30. I was like, what the fuck are you talking about?
What are you talking about?
Hey, have you fed the girls yet? No? Okay, I'll raw dog it. You're like, what the fuck? Okay, time to get serious, guys. We got some serious stuff to talk about here. This is not going to be a funny episode. It's going to be a really serious, hardcore episode because we're talking about trauma and post-traumatic stress and a whole bunch of stuff. Well, actually, you know what we're going to be talking about? We're going to be talking with our friend Erum here about FND.
Great segue.
FND. And FND. Well, firstly, I'll say this: Erum is a scientist.
Oh.
Fucking a hell of a lot smarter than the three of us. I can tell you that. And you've been diagnosed with FND, and so I'm curious I'm curious to know what the fuck FND is. But from what I gather, FND is not it's a neurological disorder where your brain, the hardware, is all fucking good, but there's a software glitch going on in here somewhere. So your brain structure's fine, but there's something about like reading the data that's a bit off. Yeah. And so as a scientist, when you receive a diagnosis of something like this, where it's like, okay, yeah, actually, so you have this brain disorder, but like it really has nothing to do with your brain not working.
Yeah.
It just has to do with your brain
not working,
being a fucking lemon, but like it's fine. Like, how do you wrap your head around that? How the fuck does FND work from a scientist's perspective?
Well, first off, the thing that's a bit confusing about it is nobody actually fully knows or understands. Like, that's what's also confusing about it. So what I understand, it's kind of like if you think about if you have something to analyze your data or to process your data, that part doesn't work well in me. So it's like my brain produces the data well, but my nerves, that connection between my brain and my nerves, they can glitch. So that's how I started to view it, is like it's kind of like the software that I have or the program that I have that links the brain with my nervous system is like a crappy program. It's like going into beta mode.
Right. Okay. Yeah.
So,
you need like an iOS update.
Yeah. So why don't you just update it? Like, can you just fix that? Like, patch it?
Yeah, that's what they say essentially to do. And like what you get told is go see a lot of therapy, avoid a lot of stress, go on low dose antidepressants. But it doesn't really. There's no kind of like if you think about how there's different programs or software like out there, everybody's gonna need a different software update. So there isn't one sort of software update. Like if you're an Android or an iPhone, it's going to be different. And yeah.
I guess the thing who built Erum?
But that's the interesting thing. And I think it's also why the analogy works really well because like your hardware, like the version update that you need is something specific to you. But like, because everybody's hardware is different and it's unique to, them, fixing that is now all of a sudden so much harder because it's like, and maybe I'm focusing too much on this analogy, but it seems to make sense in the sense that, like if they're saying, hey, you can do therapy or, hey, you can try this thing, it's really like, well, we don't know what's going to work for Erum. Like we don't know what works for her hardware.
So I guess before we get into the sort of the why, maybe give us a bit of a background on like what actually is FND? What the fuck does that mean? Like how does it present? How does it affect you on a day-to-day basis? Like, what's actually happening? Even though we don't know what's happening, what's happening?
Yeah, no. So for functional neurological disorder FNDs, for me, I have it. There actually are different subtypes, but I have more of what's called the movement subtype. So I have issues with movement. As time is passing, though, you can get what's called flare-ups. So if I get for me, with my FND, if I get very emotionally stressed, or if I I'm out late up night gaming and I get 2 hours of sleep for a couple days in a row, layered on with emotional stress, my symptoms manifest as the left side of my body will literally just start failing. So I feel really, really weak. Sometimes if I even just try to grab a cup, I'll just drop it. I don't have good motor control throughout the entire left side of my body. I also just get very numb. So I don't have sensation in my body on the left side. And when somebody touches me on my left side, even I'm talking about literally head to toe, my face, my arm, my foot, I don't have as much sensation. The other kind of, and it was scary the first time it happened, of course, was if I sit down, I can lift my right foot, but I can't lift my left foot. I completely lose the connection with my foot. But I can still walk, which is confusing because I'm well, why can I walk? But other people with FND, they can get to a point where they can't walk when they have a flare-up. It just doesn't work. It's kind of again, going along with that program analogy, it's like somebody deleted the code for how to move your body.
Weird. Are you left-handed?
Well, that's I was born left-handed, but I was forced to be right-handed. It's a common South Asian thing where they're oh, left-handed is that's sinful. So I was forced to be right-handed. Yeah, it's that kind of situation. But yeah, and then the other thing that can happen is my eyesight will kind of go in and out of my left eye. So it's literally all just the left side of my body. It was cool. Sometimes, I'm saying cool because it's my coping mechanism is to put on my scientist hat and analyze, but I'll get asked to do funny nerve tests, stick my tongue out and move it to the left and right. I can't even move my tongue to the left, funny things like that.
Can you fully rotate on the left side?
Are you an ambi-turner?
Yeah, right.
Like an owl? You mean? I can go through.
Yeah,
like Derek Zoolander.
Yeah, like Derek Zoolander. Whatever.
I'm pretty flexible, actually. I'm pretty flexible.
She's South Asian. She's got a South Asian background. I don't think Zoolander was that huge.
Okay.
South Asia.
That would have been absolutely that must have been absolutely terrifying when you first noticed it. As you were saying that, I was trying to if I could remember the first time I ever woke up in the middle of the night and couldn't feel one of my arms because it was over my head. If I could remember what that experience the very first time, going, holy fuck, I can't use my arm.
Yeah. At that point.
But I'll never remember that because I was probably a very small child. So that first time that this happened to you, were you holy shit, I'm losing full function of my body?
Yeah, I remember because I was at work actually. And I was sitting there in a boardroom and I was I could feel just the left side of my body just failing. And I just was kind of I was holding it together so tight. And then I had to find somebody, because my face even started swelling up. The left side of my face kind of started swelling up too. And I had to ask somebody, I'm can you look at my face? Just tell me, does it look messed up? They're yeah, something's going on. I'm what do I do? And people are you should go to the hospital. And I had somebody kindly walk me to the hospital because I had to go really slow. And that was an interesting experience because I was I think something's going on, when you're at the ER and they looked really, and I got, it's bad when you get seen right away.
Totally.
When you're waiting forever, it's, it sucks to wait forever.
There's a guy with a fucking knife sticking out of his neck and they're okay, sir, you gotta wait a second. This lady's fucked. She's we got to raw dog it right now.
That's exactly, yeah. And it was
I don't know if anyone's gonna have the context.
No one will have the context for me using raw dog in that. But that's what makes it fun.
Okay,
guys, we're gonna take raw dog and we're gonna just use it.
We're making it our own.
We're gonna make it our own, and people are just gonna start using it the way we use it, which makes no sense.
Okay.
So anyway, so you raw dog you at the ER.
Yeah.
Go ahead.
Yeah, I was at the ER and I'm like a little like, I don't know, maybe this is just something. Like maybe I'm just tired. I'm just stressed. Because stress is stress is very normal for me in the life that I've lived so far. And I see the doctor, she's really concerned. She's like, have you ever been like diagnosed with a brain tumor or anything? I'm like, what? I was like,
Oh my
no.
God.
Like it got
wow.
to that level. And she's like, okay, like you know, it's bad when like they sit you down and they sit down, like the doctor, and she goes in really close. She's like, we need to do imaging ASAP. Like you might have a brain tumor. I'm like, what? It's like,
Wow.
and I started crying, obviously.
Oh my
I was
God,
like,
that's scary.
okay, like, what do I do? But they rushed me to get some brain scans like that same day and like a few days later. And I saw a neurologist a few weeks later. And one of the things, because she's like, you might have a brain tumor, multiple sclerosis. And she kept
Oh my
asking me over
God.
and over. She's like, does anybody in your family have this? I'm like, no, not that I know of. Like, no, I don't. Like, and I just, obviously, every time I waited, I kept Googling things, ChatGPTing things. Like, I was like, I need answers and whatever. But it was when I went to my neurologist, this is hilarious, where this was my first time seeing one. And he, like, because when you have nerve issues, they make you do all these funny movement things. You know, the thing, or like, the old children's books, they'd like do that little hammer thing, tap your knee. Like, they do that all over my
reflexes.
body.
Yeah.
They check, the reflexes. But they'd make me do things like as if I was drunk, like, you know, tiptoe, walk on, you know, a tightrope thing. Like, I'm like, but it was weird because I could see some of them I couldn't do. I'm like, I did not drink. I know I'm good. It's like, so, but
It would be
was when-
super funny if you were the neurologist and you just like added in some stuff.
Yeah, like a breathalyzer.
Like just for
Yeah.
fun. Like just
I've always been kind of fearful of being pulled over, having not drank, which is always the case, and then being asked to like do some of those tests, and then being like, "Yo, do the alphabet backwards."
I can't do
Because
that.
I'd be like, I can't do that.
I don't think that's real. I don't think they actually ask you to do that. If they ask you to say the alphabet backwards while walking, like sidestepping and touching your nose, I'm gonna be like,
I can't do that.
guys, like,
What am I, a circus
yeah,
animal?
yeah.
Like,
What do you want next? You want me to pull my foreskin over my head? I don't have it.
oh, wouldn't you want
raw dog?
I can't raw dog this.
when you want to do that stuff as a neurologist, like even if that wasn't one of the tests, just for your own pleasure,
yeah. Just to be
like asking
and-
them to say the alphabet backwards or pull their foreskin over their head.
Because doctors are always trying to, you know, just like get a kick out of the patients that they're
That's
seeing
it.
that are
Hey, that's
facing a crisis.
That's what we're pushing for here. So if your doctor listening to this, incorporate more of that weird, wacky shit raw dog in the
Yeah,
practice.
can you pat your head and rub your belly?
So I mean, you were showing him this stuff, and there were things that you were failing, but you're telling us you weren't drunk. Okay. So
What happened?
Was this enough for him to go, oh, I think I know what's going on here?
So the strangest thing happened to me, and again, like, I think it would be useful if more people knew about this, because I didn't know about this. He made me lie down on my back. And so he did a test called Hoover's test. But this is what's interesting, is they don't tell you anything before, and understandably so, because they're like, just do these movements so you don't overthink anything, right? So he told me to lay down, and he's like, lift your right leg. I lift my right leg. He's like, lift your left leg. I can't lift my left leg. And it's scary, and I'm like holding in tears or whatever. And then he pushes, like, so if these are, I'm gesturing my hand, so he pushes down on my right leg, like he pushes downwards on it. And then so it was weird feeling that pressure. And he's like, okay, I'm pushing. It was kind of like I was in like a bit of a Pilates class. I'm like, what's going on? Like, he's like making me exercise here. And he's like, push. He's like, he pushed down on my right leg. He's like, resist the force. So he's like, push up with your right leg, push up with your right leg. And then all of a sudden he's like, now lift your left leg. I was like, what? And then boom, I could lift my left leg.
Whoa.
And I was like,
whoa.
What the hell just happened? And I was like, what? And he smiled. He's like, you have FND. That is how he diagnosed me.
Oh,
and I was
whoa.
like, what? And
It's like he was like, he was just like, all right, stiff as light as a feather, stiff as a board, light as a feather, stiff as a board. And you just start levitating. He's like, you got F&D.
Yeah. It was the wildest thing ever. And I'm like, well, how did you know? And he's like, because when I distracted your brain was regained the ability. So that tells you it's a circuit issue. It's a nervous system issue.
Okay.
That's how they diagnose you.
And they get a bonus if they don't have to use more super expensive imaging equipment at the hospital.
Well, here's the thing that's really wild.
We can diagnose you with it.
Dude, it's Simon Says. It's Simon Says. You're like trying to get them going really quick. You're like, Simon says this, Simon says this, Simon says, and then they don't say Simon Says, but you do the thing and then you're out.
Yeah, and they're like, got you. Got you.
Yeah,
You're
exactly.
out.
Got you. It's F&D.
Yeah. And then she was out of his office. I mean, Erum, the thing that I find so fascinating about this, about the journey of trying to figure this out, is so again, I come back to like the hardware versus software thing. Immediately they think, oh, her hardware is fucked up. She's got a brain tumor, or she's got, there's some, she's got MS. She's got some sort of illness that some sort of thing that's attacking her brain in a way that like she might need surgery. She might need chemo. She might need some sort of like intervention that is invasive or intense or whatever. But in reality, all of this is based on the fact that you had a traumatic upbringing. At least that's what I've gathered. Yep. So FND for you, the way that the reason why you're dealing with this is because of a history of just like incredibly horrific trauma from your childhood. Is that correct?
Yeah, because even in that same appointment, when he kind of, smiled at the fact that like a relief of like, okay, he figured out it was FND. The next question he asked me was, have you been through a lot of trauma? Do you have depression? Do you have anxiety? And I was like, how does this even connect? Because in my mind, I still thought about it separately. Like, this is like a motor issue, a functioning issue. This isn't going to relate to trauma. But we talked for the next, half hour about my mental health history and my life. And I didn't get the connection, but now it's been a couple of years later, and now I see the connection.
And when he asked that question, obviously, like you were going, I don't really see the connection here. But like when he asked that question, in your mind, like at that point in time, were you at a place where you could recognize that, like, oh yeah, no, I had a fucking fucked up childhood, or did you need to like kind of, did you need like somebody to help you unroot that because it was so traumatic that you buried it, or put it so far back that like it was almost something that you've never actually even admitted to or acknowledged because it was so dark?
Yeah, it was kind of halfway through that, because when I saw my neurologist, I had been seeing a therapist for, I think, 4 years at that point, but it took 4 years for me to start realizing, okay, what I went through wasn't normal, or a lot of stuff that I've survived like is not okay. But what was interesting is when he asked me if I have anxiety or depression, I had to pause and I'm like, no, I don't. But he kept asking me over and over. I was like, but I haven't been diagnosed with it. Spoiler alert, 6 months ago, I was diagnosed with anxiety and depression, but that's because I couldn't recognize it in myself. I didn't understand it in myself because I didn't let myself feel it. And, growing up as somebody who has been so good at bearing their feelings, I think I'm like really good at, the psychiatric tests at like, kind of missing it, because I present as like, I have it all together. Like I'm fine. But what's interesting in my case is because I have the FND, that's when psychologists and psychiatrists started realizing, okay, yeah, you do have anxiety and depression because you have FND.
Right. Like he was asking you because he's basically saying like you kind of have to, like you have to have it at some level for this to be what you have, which I am confident that you do. This would have to be present in you, and so like and you had already been working with a therapist like for a little bit of time, like when this happened, but you hadn't arrived at a diagnosis of anything.
That's right.
With your therapist.
Yeah. So that's why it was confusing, because I was like, I've been seeing a therapist for 4 years, because he kept being like, you need to do more therapy. I'm like, I'm already seeing a therapist like twice a week.
You need to see two therapists.
That's what I was like. I'm like, what kind of therapy? Whatever. He's like, you just need to. And I was
every
like,
kind. Hypnotherapy.
Right? I was like, that's a lot of money.
Massage therapy.
Erum,
all of it.
Do you think that and like I'm a big fan of talk therapy. It's been really helpful for me in my life.
No way, really?
But I'm curious if you feel like, because you weren't dealing with these FND like symptoms, before, and you mentioned that you'd gone to therapy for 4 years. Do you think there's any connection or possible connection with like sort of starting to like
Is it your
uncover
therapist's fault? Is what he's asking.
I'm not asking
Yeah.
it like that, but I'm just curious, like starting to pay more attention to that trauma.
Yeah, I think it is part of it because it's kind of like you start opening a Pandora's box when you start feeling your trauma. And it's not to say, I'm not saying it's a bad thing, but like the healing journey, as woo woo as that sounds, like it's not, it literally is like you have like, like a knife in you, but you're used to, and I'd say I have like multiple knives in me, but I'm used to having those knives in me, in my body, in my mind. And it's like that process of like slowly pulling that knife out. That's when it starts to hurt. And then when you finally start pulling that knife out, that's when you have the wound. Okay, now you got to understand that wound, and now you got to start healing that wound. And it takes a really long time, but definitely I think I needed the talk therapy to actually start having that connection with myself. And then I started noticing like, hey, like not, and when I say connection with myself, I mean physically and mentally. I like didn't notice sensations in my body. Like as somebody who did like a PhD, like you get used to being on a computer for so long. Like I numb out that my back hurts. I numb out that my neck hurts because I get so, in the zone. And it's like days later when I'm walking around, I'm like, well, why does my back hurt? And like I couldn't put the two and two together.
Mm-hmm. And I've spoken to some people before about therapy, and like some people's hesitancy about going is this idea that like they're like, oh, I feel like my mental health is like balancing on a fucking needle right now, and if I do anything to like disrupt that, then I'm just going to totally fall apart. And so like they're like holding things together, and they're like, I just really don't want to go there. I don't want to like give that the time because I'm worried about what will happen. And I think your analogy of the knives is like a really good way to think about that. Like, if you don't go and work on those things, and not saying that you have to, and that talk therapy is necessarily the right way to do that, or best way for you, but like those wounds will show up in your life at some point, and most likely unannounced at a place where you aren't hoping they will. And so by going through that and working through it, and even in your case, I mean, you didn't expect that F&D would show up when it did, but it is part of that, like that, as you said, healing journey is to start to work on those things. I guess like that's kind of how I feel about it. Like what are your thoughts?
It definitely was like something, and I don't know if you felt like this, and I think I started doing this experiment with my friends where it took me years in therapy. Like a common question they ask you in therapy is, how do you feel? And it took me years in therapy to actually answer that properly, because a lot of the times my therapist would catch, I would say a thought. She's like, how do you feel? I'm like, yeah, it's like, I think it's really busy, and da, da, da. She's like, so that's a thought. And I'm like, what? And I'm like, is it though? And then I would do this little experiment with my friends, right? I'd ask them, I'm like, well, how does it make you feel? And I noticed they'd say a thought too, because we're not, the society I think we live in, we're not, raised to think quite about feelings. There's a difference between what you think about something versus what you feel about something. And I'm still not the best at that, because you need to understand, a thought is like more like an opinion or something, but a feeling, like I had to start looking, like maybe you're familiar with this, like there's the feelings wheel.
Totally.
And,
my therapist brought it up like a couple months ago. It's crazy to think, and I use language like I feel like, and she's like, no, that's not a feeling. Like, and I say that all the time, especially when you get emotional in a situation, if you're in like conflict, you're trying to like explain how you feel, and you're saying things like I feel like, but you're not explaining your feelings.
Yeah, you're just raw dogging it.
Yeah.
And it feels so. I understand what probably a lot of people who are listening who haven't been to therapy or haven't really thought about this. It sounds so like intangible, and like it's really hard to think. But I totally know exactly what you're saying. It makes a ton of sense.
When you got your diagnosis, and you sort of were then, I'm assuming there's like a period of, especially as somebody a scientist and somebody has a PhD, I'm sure that there's like a lot of curiosity and like looking into this, like that would follow.
Well, wait, just before you go on, what kind of scientist are you? And like, what is your what is your what is the what do you know?
yeah. What's your area of knowing?
By training, I'm a biochemist. So I have a PhD in biochemistry. And what I think is fun about like a biochemistry degree is like there's for those people
drugs.
you can be in the health field, but also like
I meant different drugs.
Oh,
He
you
meant
mean
illicit drugs.
I meant a little bit of Breaking Bad. You know what I mean?
I do. I love Breaking Bad.
Biochem.
There's a lot. My knowledge base is pretty deep because it's biochemistry. Like Leninger is like a biochemist sort of guru. He has a famous textbook, but he defines it as the molecular logic of life. So you really get into the nitty gritty of like how does life work, and like that's not just for humans, for anything, for plants and stuff. So what's nice about my degree is I can really get at understanding at like a cellular molecular level, like how do things work.
I've heard that biochem is like in undergrads is like a notoriously hard place to be, where like people who have to take it who don't really feel like they need to take it for any reason are like, fuck my life that I have to take this course, that I have to get through this course that I don't really need, but it's like a part of the curriculum and it's the hardest fucking thing.
There's a stat that like 90% of people who do that undergrad develop FND.
Right, that's right. And
crazy.
So here we are.
Without even any trauma.
That's right. That is the trauma. Biochem. Taking biochem.
I actually forfeited biochem and took bedchem and
oh yeah,
fucking straight A's, brother. You know what I'm saying?
Oh, dude.
Hell yeah, up top. Let's go.
Totally, yeah, dude. That was really great, dude.
Raw dogged it too.
We actually
we're
trying to ramp up our bro humor on the show a bit more. But the question that I was going to ask before was that you get this diagnosis and then you're obviously very a very curious person. So you go and you start looking into this. Is it like, if you've had serious trauma in your life, is there like is it like a coin flip that you might end up with FND? Is it like 10%? Is it 2%? Is it, is it weird that it happened now and not earlier? Or like, what does all that stuff look like when you started looking into FND?
So here's the weird thing about it. It's so, what's called black box, because I was lucky I found a neuropsychiatrist. I didn't even know that existed. And I did like a 2-hour interview with his team. I had to talk about my whole like mental health history, life history, all my trauma. And they told me, they're like, yep, you are like the perfect case for FND. That's what I was told, like of all the things trauma I've survived. But all I was told is that I think at one point they were in my case, they were surprised I didn't see issues earlier. So I wasn't told exactly like any stats or numbers, but the kind of on the flip side, what's really weird about it is, 6 months ago when I had a psychiatric assessment, the psychiatrist told me, she's like, some people with FND one day just wake up and they're fine. Like it just goes away. I was like, well, how can I make that happen for me? She's like, it's just a weird, like, it's bizarre. It could just happen at any, like, no one knows. So basically that's the short answer. No one knows.
Is there like a, because when this stuck out to me in the beginning, when you said something about like stress and like trying to avoid stress, which just like the sentence "try to avoid stress" is like, I mean, really, it's like it's a comedy, really, because life is life, and that's there's stress no matter what. But how you deal with stress and how you approach stress and how you let it sort of like flow through you and like feel it and understand it. I mean, that's much more within your control than actual stressors. Avoiding stress. It's much more plausible to deal with it well rather than to avoid it. Like, is there what kind of component does the way that you deal with stress have on the way that FND might affect you or flare up for you?
It's like, I think what I've noticed for my body, it's the biggest cause. Like if I'm around people or a person that's just really stressful, like really just for me, like just reminiscent of the trauma that I've been to. That's what I really noticed, if they're reminding me in some way of the trauma that I've been through. So just really being very invalidating, being really confusing, not being really clear. And I know that might sound like, well, that just sounds like you're maybe like an average person you run through like time to time, but it's just like, it's repeated of things that I've survived. It's kind of like my brain gets triggered because of things that I've survived, and it's like it just starts failing in that way. So the stress is a big part of it for me. But that's from what the reading I've done. It is like that for most people. That's why you had you hit the nail on the head of like, well, yeah, try to avoid stress, but there's a layer to that that's missing, is like try to avoid the stress that is stressful for you, because not everybody gets stressed out by the same things.
Yeah.
Right.
Yeah.
Like maybe.
Yeah.
I was gonna say, like, maybe for me, like, if you asked me to do like a biochemistry course, I'm gonna be like, yeah, let's do it. It's fun. But for other people, that might be really stressful.
Yeah. It makes me think about, so I mean, like, all of this really, has, I mean, from the very start, like once we started talking about this, I couldn't help but think about that, that notion of like how trauma lives in the body. And so like this is almost like a perfect example of that in real time. Like the trauma that you went through as a child, it's and maybe it would be helpful for us to like go a little bit into the backstory so that listeners have a bit of context. It's like this is the type of stuff that I can't imagine where the body is going to be able to store this kind of trauma, you know, and if it does, then it most certainly is not a huge surprise that it's going to like have some sort of effect, whether that be long down the road in the future or like, you know, pretty immediate in the moment. As comfortable as you are with it, I would love to hear a little bit of the backstory of like what, you know, where trauma for you began, and what were the things that you've sort of faced that have obviously stuck with you and have been, you know, the root cause of FND, what you're currently like experiencing now.
Yeah. So I think what is helpful too is like, before I dive into it, is like I had to look into like what is trauma. Right. I had to look that up. So for people that are listening, that might not realize or realize, trauma is actually, because for some people it's a very heavy word, and it is a heavy word, but it's like, my point is like, it by definition, it's an emotionally distressing event. Mm-hmm. And again, it's kind of like the word stress, where something that may be stressful for one person may not be for another person. Something that's traumatic for one person isn't for another person. But I'd say my trauma, like, you know, there's different kinds of trauma. It started at as young as 3 years old. I have deaf parents. So I have parents that they immigrated to Canada in the 70s. They never got to go to school. They weren't allowed to go to school. My parents are from Pakistan, so they're born in the 50s. And in Pakistan in the 50s, like you and you're deaf, like you don't go to school. Like you're just like, my mom was almost sold as a slave. Like that's a whole other thing. But when I was born like here in Canada. I started signing as young as my first language is American Sign Language. So I was able to communicate as young as like 6 months old, because I could say milk. You know, baby sign language is a common thing. But when you have deaf parents, so I'm what's called a child of deaf adults. Like I was able to communicate, you know, a lot faster. And as young as 3 years old, I took on like adult responsibilities. Like I started even like picking up the phone, like making phone calls for my parents, like, you know, making their doctor's appointments. I very quickly became the family administrator, like the family therapist, the family interpreter. And I was even like the family therapist too, breaking up fights between my parents. And that, as young as 3 years old, became my normal. And I had to work through it a lot in therapy to understand like that actually is trauma, because I thought, even now as I'm talking about it, I'm like, there's still a voice in my head. Well, like, that's good. I was just a great daughter. I was very helpful to my parents, but I'm what's called a parentified child. So I had adult responsibilities at a very young age. And what that did to me is it makes me it made me normalize stress that young. So I didn't really have like a proper childhood, because I feel like now, you know, I'm trying to do more fun things and try to have some of that childhood now. So that's like kind of the trauma started there, you know, being the family, what one of my therapists calls like the family administrator, that role, taking on that. And it's very stressful. It's very exhausting because it's like a 24/7 job, right? And then things started to get pretty heavy when I was 11 years old. You know, I went through sexual abuse by a family member, and I had an incident where I was almost sex trafficked one night. And it's a horrible thing to happen to anybody, but what was actually harder about it for me, and I had to talk to a lot of therapists about this. I was like, yes, what happened, that like being sex trafficked is frightening. It's very scary, but it was the ensuing emotional neglect I had because I wasn't allowed to get help. I was told to just, you know, be quiet, not say anything about it, which again, for immigrant families, that's really common because immigrant families often have a fear of children's day taking away the kid. And that's what I was told. Like, if I get help, I'm going to be taken away. So again, as 11 years old, I kind of normalized in me, like, don't ask for help. Like, that's what you do. You figure everything out figure everything out yourself, shove everything down. Like, don't talk about things. Don't get help. Don't feel. Which I realized through years of therapy, realized, that's where that started. Like, the disconnection with myself. And I started to cope because I was like, well, how do I deal with this heavy situation and the feelings I had? But what I started to learn at 11 years old as well, when I start, you know, doing things for other people, when I start baking for people, when I start being that A+ student, when I start volunteering a lot, being really, really thin, because, you know, in South Asian culture, it's generally, it's changing a bit now, but like, it's really revered if you're a woman and very, very thin. I realized that made me feel safe, even though that's not a healthy way to feel safe. So I basically became what I call it like the good Muslim girl. You know, I kind of lost myself and I did that. And now what I realize is that I was just really in survival mode. I became a people pleaser, and people don't I think about people pleasing enough too, because people pleasing is when you're just making everything about other people. And really, it's like a disease. It's a disease. And I think it's not a form of mental illness, but I think it should be, because you really lose yourself, and to the point where you're just fully thinking about other people. So yeah, like growing up, it was always weird because I thought I was fine because I was making everybody around me happy, but I wasn't happy. I didn't realize that. Right.
It's also very easy for other people to not see issues that you might have, because it feels like you're so considerate and you are like looking out for other people, which it almost seems as if you can only do that if you're also looking out for yourself. Like, that you can only take care of people if you like have your own shit on lockdown, which is like, I think often not the case.
Also, when you're the quiet, like good, well-behaved kid who's getting the good marks, then you know, you're not getting the attention because, you know, people in positions of authority or power that are like trained to look out for signs of like, you know, challenges that are going on in your lives. They're not seeing that because they're not seeing these signs that, you know, you are dealing with.
It's like the troubled kid, the kid the kid that's always causing a ruckus, the kid that's, you know, like getting into fights and like all that shit. And obviously that wasn't you.
Yeah. Like there's a term that's called masking. Like, I'm an expert masker. I know how to really mask my feelings and just put on a smile and I love making people laugh. I love to laugh. And I just got really good at that, to just mask my pain from all the trauma.
And then, so after, you know, many years, this then like manifests in this.
Well, you know what's really interesting here is and this is something that I just remembered as I was looking through the stuff that you had sent us. Even before the FND, you were diagnosed with vaginismus, which is something we covered on the show years ago. And
Oh,
if you guys
okay.
don't remember, for any of our listeners who aren't aware, vaginismus is like it's a condition where the vaginal opening
Starts
is
talking.
like it starts talking. It starts talking
Great.
shit.
Yeah.
Yeah.
It's just like sup, motherfucker.
Yeah.
Sup. No, that would be
Develops a
pretty
mind of
cool.
its own.
Actually, I
It's
don't know if that
crazy.
would be a disorder. I think that'd be a kind of a.
It's like
part,
it's like phimosis.
in order.
It's like female phimosis, sort of.
Sort of, yeah. I mean, it's the vaginal opening is very tight, very very closed off, and it
Painful.
very painful to like, sex is very painful, and more often than not, from what I gather, vaginismus is often a direct result of childhood sexual trauma. So just this sort of like interesting thing here to like notice that. And again, I come back to what I said, which is like that trauma lives in the body, and how does it kind of present? How does it store in the body? How is it going to have an effect on you? It's like, I mean, it's sort of just like you are the example of like how a plethora of different types of trauma can like literally store itself in the body, where the hardware is good.
Yeah.
It's just this glitch in the software.
Yeah.
Do you think with like masking, and I'm familiar with the term myself from therapy, do you feel like for you that the masking had prevented you from being able to actually see what you were dealing with too? Like were you aware of the sort of emotional and like mental trauma that you had experienced?
No, which is pretty wild, like looking back in it, because I guess I never talked about it. I didn't get any help. I wasn't talking about it. I wasn't processing it. So I numbed I literally just buried it. And I know, like, the interesting fact about the mind, and maybe you guys know this, is like how like 90%, it's like something high, like 90 to 95% of your subconscious mind, drives your conscious mind. And it's like, I suppressed it so badly. Like subconsciously, like I would just keep myself so busy. I remember in high school, I had I had a part-time job. I was only sleeping 4 hours a day. I had like over 200 volunteer hours and stuff, because that was my subconscious coping mechanism. Because if the less I sleep, the more I keep myself busy, I don't feel things, right?
I feel like I could have used some of that in high school.
Like you could have used a little bit of the stuff.
I mean, a little less of the trauma, a little more of the what sounds like some pretty sweet masking.
do your work and like help other people.
Fucking do something with my life in high school.
It is interesting though.
All my teachers thought I had trauma. I was just a piece of shit. I was just
Slick back
I was
hair.
just a shithead.
I know. I understand though, Erum, what you're saying about like I guess a little bit of backstory for context. I have ADHD and have been going to therapy for about 4 or 5 years now. And it's interesting, when I first went to therapy, I first told my therapist, I was like, hey, look, like I just heard that therapy is helpful and I don't really have anything specific to talk to you about. But like, I'm just here to see how this is helpful. And I started talking about some of my experience with my parents getting divorced and my childhood, and like very quickly realized that I did actually have a lot of things to talk about. And I always did well in like junior high and high school. Growing up, I didn't have to work that hard, but like things sort of came easy. And then I went to university, and all of a sudden I like failed out of school, and I couldn't like focus, and I couldn't apply myself, and I couldn't like do the stuff that required, like reading chapters on your own and the work that they weren't holding your hand to do, basically. And the point of bringing this up is like, there's this realization, when I started going to therapy, I was like 31, and you go like so long in your life thinking like, oh, well, this is just the way that it is, and this is who I am as a person, and like I'm a result of my own decisions and my own hard work and my or lack thereof. And all of a sudden you hit this realization where you're like, holy shit, like there's so much of me that has like influenced or shaped the place that I'm now at now that like I haven't even realized.
Yeah.
Like I don't recognize that person that got me here. And
Yeah.
also I didn't realize how much, to your point about like that 95% of like your decision making is your subconscious. It's like, it's almost like somebody else has been driving the bus and I got here.
Yeah.
And like that like revelation of like realizing that there's such a big part of you that like hasn't been acknowledged or like, you know, dealt with in terms of like the trauma that you recognize and have to work on. And all of a sudden you have to come to terms with this feeling of like, oh fuck, this is part of me. And like, this is here. It's like, I mean, for me, it was pretty crazy. And I imagine that like for you with this like significant trauma and really challenging childhood, that like that was a huge fucking thing to like come to terms with. And so like, what was that experience like for you?
You know, I think it wasn't like, you know, I got married in my mid-20s, and it wasn't until I got married in my mid-20s that's when I found out I had vaginismus. And like that was the first time that I was told something was wrong with me. Like I was so like, I'm like the top student. I'm like this, like when I go to the dentist, I love it when they tell me your teeth are like clean. They're good. Like I love that because I'm like, yeah, like I'm fine. Like I'm great. My teeth are like so good. Like that hit my ego so hard when I was told that, because I'm like, well, what? Like, what are you talking about? And that was the first time in my mid-20s, like that any professional asked me, they're like, have you been through sexual trauma? And I remember my jaw dropped because I'm like, what the heck? Like, this is something that happened like years ago when I was a kid. And I'm like, I did my best to forget about it. And I'm like, that's how I started actually seeing therapy, because they're like, you need to see a therapist. And I was like, why? Like, it was my ego coming at play. I'm like, no, I don't. Like, I'm fine. Like, I'm fine. Like, everything is fine. Like, you look at my blood work, like my teeth, everything. Like, everything is fine. But they're like, no, like, kind of like what Jeremy was saying. Like, my body is reacting a certain way. Like, it's not.
Mm-hmm. Yeah. I mean, the thing that's so fucking wild to me is like just how like fresh and new a lot of this is. Like, you know, you said like you're only diagnosed with like you were only diagnosed with depression and anxiety and like PTSD like 6 months ago, which is fucking bananas considering like the history that you've shared with us when, you know, we haven't been talking for that long. What do you like? What are you currently? How do you move forward? You know, I know one thing you wrote, it was that you're a recent boxing enthusiast.
Yeah.
I don't know if that's a part of your like the way that you're trying to manage this by just like beating the ever living shit out of fucking punching bags.
Yeah.
So like, yeah, like is that a part of your like healing journey? What is it like? What are you working on now to try to like find the new part of yourself that's going to like move forward into these next chapters of your life?
Yeah, so definitely boxing helps me get out a lot of rage. But like, because again, being like a recovering people pleaser, which is actually a lot harder than people make it to think, and having PTSD, like it helps me process my pain that I wasn't allowing myself to feel. And sometimes I do something I try, it doesn't always work, but when I'm punching a bag, I'll try to kind of let my mind think like, what is it that you're punching? Like, who are you punching? And let yourself feel that anger out. Plus I feel badass doing it. I'm like, I love that. I always like grew up playing Street Fighter, you know, and stuff. So like, I'm channeling my inner Chun-Li. Like it feels really good, even though I'm not kicking, but you know, but that's what I like to, even like weightlifting, because instead of people pleasing and trying to stay safe by making others around me happy, I'm trying to convert that by being physically fit, by feeling strong. Because if I get in a situation where I need to protect myself, I feel like I can. Like it does something mentally. Like since I started boxing, if I'm in the streets and like somebody looks kind of suspicious, I'll be like, I'm good. If I have to throw a punch, I have to, but I don't, you know what I mean? It's just like the fact that I'm capable. Yeah. It makes me feel like it makes me feel safe in a healthy way is what I'm noticing in myself. The other thing I like to do is just like, it's been a journey this past like 7 years, like, especially like I didn't like, I was married, I went through divorce. And I think that the interesting thing with divorce is you really start asking yourself like who you are as a person, because you don't have that partner anymore, right? And that's a journey. And I had to start asking myself like, well, what makes me happy? Like, what makes me happy? What is it that I like to do? And one of them was boxing. That was something I've always wanted to do as a kid, like bringing back more of my tech side into myself. I really love computers and getting back into gaming. I didn't let myself game for a long time. I have a Minecraft group with friends. Like I love gaming, and I also, something that makes me feel really happy and fulfilled is like I actually volunteer with Big Brothers Big Sisters Toronto, and I have a little brother. So I'm interesting because I'm a cross-gender match. So usually people like they'll do like, the same, big sister, but the little sister. But being with him and hanging out with him and just being a mentor for somebody, because I'm with a boy that's an at-risk youth. He's 13, and he reminds me a lot about myself. And when I'm with him, like of myself, because he's been through a lot of trauma. So when I hang out with him and I see that I'm making him feel safe, like it's hard to fully articulate, but there's something about that makes me feel healthier, because I can feel that I'm fostering a safe, kind relationship, and it's like I'm making him feel okay, that it makes me feel okay. And it helps with my depression, and it helps with my anxiety.
I picture like let's say like someone made a movie about your life, and then like at this stage in your life, it's like you and your little brother, you guys are like having a day, and you take him to the arcade, and you're like, let's go play some games that I grew up on. And you guys are playing Street Fighter, and then like one of his like bullies comes in, and the bully's like dad. And then you turn
Who's
around.
Also a bully? Is the bully's dad also a bully?
The bully's dad's also a bully for sure. Yeah. And then you square up and you're like, "What's up, motherfucker?" And then you use your boxing skills
to assault the child,
to beat the shit out. No, whoa, Taylor, whoa, no,
sorry,
no.
My God.
Well, beat the shit out of the dad.
The bully child deserves at least one.
The bully child just
hit too,
watches his dad get beat up by a woman, and he goes, "Oh shit!" And then your little brother's like, That's right, mother fricker, and because you're like, watch your mouth, kid, and then he's like, yes, ma'am,
right? Because you're a good big
yes,
sister.
sis, yeah, exactly.
But that's funny you say that, because I actually have taken him to the arcade, and I did show him Street Fighter,
and I did beat the fuck out of one of his friends' dads.
No, that part hasn't happened yet, but maybe I need to go and make that happen.
Yeah. It's a matter of time. It's a matter of time.
Erum, I want to ask you a question that we typically ask most of our guests, which is, it's a 2-part question, which is, what would you say is the biggest thing that FND has taken away from you?
Oh, this might be a weird answer, but it's taken away that need for me to shrink myself and to people please. Because for me to stay healthy and deal with the FND, I can't people please and shrink myself and perpetuate these, allow for my anxiety and depression to fester. Like, the FND has actually been a blessing in disguise in that way, because I didn't mention this, but it's actually considered a rare disease too. So it's like, there's just so much unknown about it, but it's taken away that need to have these unhealthy mental coping mechanisms.
What would you say is the biggest thing that it's given you?
An appreciation for being able to move my body. Because you just to be able to like move your foot, like that's exciting. That's cool to just move your foot. Because like right now, if you imagine like if you try to wiggle your toes and you can wiggle your toes, like that's amazing. Like to lose that ability is really scary. So it's nice to be able to have just a moving, functioning body where I can just move and walk.
Mm-hmm. And before we wrap, where are you at now? Like, where do you sort of see yourself in this journey?
I'm wanting to talk about it more. Like, this is the first time I've ever been really open about things. So, like, I just really want to raise more awareness about FND and talk to people, but also just being a safe space for people when they have mental health issues. Like, I have a lot of friends with ADHD that are struggling with it, and you know, it's a form of neurodivergence, and PTSD is also a form of neurodivergence. So I get it. Like, I totally get it. And, you know, just, I guess in general, like with my health, I'm stable right now, but in terms of just life overall, I don't know. I just like, there's just, it's exciting. I think I'm at an exciting stage of life, but there's a lot of doors and stuff in terms of my personal health, what I want to do in life, but still trying to figure a lot of it out.
Well,
Sweet.
I mean, I gotta commend you because having not really talked about it much, and deciding to at the time of deciding to do that, signing up to come on this fucking podcast and just talk about it so openly and so yeah, like with so much vulnerability, like, fuck, you're doing it. You really are doing it. And I just think it's so incredible.
Yeah,
I-
A plus.
Yeah.
Good
You're really pleasing.
And also,
Yeah,
I am
you're really
pleased.
pleasing
I'm
all
not
three of us.
We're
here.
very
pleased.
pleased. We're very pleased.
This
with
is
coming.
great
And
content.
thank God. I hope it wasn't bad for you.
No,
it
but
was
really, like, I commend you. Like, I think what you're doing right now is it's not easy, and you're doing a really great job at it. And I hope that in the very least there's somebody out there who hears this and it makes a few things click for them in their own life, which I can assure you that will happen. So on behalf of that person or those people and the three of us, thank you so much for coming on the show today, for sharing this with us. It really does mean a lot.
Oh, thank you. And thank you guys for making me laugh, because I really do think like there's a reason why there's that saying, like, laughter is medicine. It does help. It helps a lot. But thank you guys in general for your podcast. I love the humor and it makes me smile, and I think it helps with my FND.
Amazing. Thank
You know,
you.
but just I mean, maybe we'll cut this out, but I for whatever reason, for the last like 20 minutes, every time you say F and D, I actually hear
S
F,
and D.
like F and D, like fucking D, F and D,
F and D. Yeah, I know.
It is
fucking
yeah.
F and D.
They're gonna say
F
S and
D.
S and D.
Jesus Christ, Brian.